Good evening. This is Dr. Klein. I'm doing my Monday, Wednesday, Friday sessions now at noon. So the researchers at the National Pain Council and JATH Education are really turning up a lot of information. We're zeroing in on who is responsible for the CDC writing these guidelines. The first question is, why did the CDC, a federal agency, write guidelines for the treatment of chronic pain? That's not what the federal government does. The federal government is actually prohibited by the 10th Amendment and by a federal law from interfering in the practice of medicine, which is a state prerogative. But we had a director of the CDC at the time, and his name was Thomas Frieden. And Dr. Frieden made the pronouncement on the day the CDC guidelines were produced, March 15, 2016, that doctors were responsible for the opioid epidemic by overprescribing. So we've kind of zeroed in on overprescribing as the central issue. He was accompanied by a person with similar values, paid consultant from the Physicians for Responsible Opioid Prescribing. This is the founder, Dr. Andrew Kolodny, and we will be discussing his impact on the CDC guidelines later. So I want to start giving you some examples of things that have evolved from the CDC guidelines being produced as the definitive document. There's 10 other opioid guidelines out in the private sector, all of which are about the same as the opioid guidelines from the CDC, except the CDC tried to set dose limits, which the CDC needed to ask FDA before they did it, and they did ask them. Dr. Kolodny asked the FDA, the consultant, and the FDA said, you don't have evidence and we're not going to change the labeling of the medicines. So he went over to the CDC, where his friend, Dr. Frieden, was the director, and they put together a CDC guideline that is so full of inaccuracies and exaggerations. I'll give you an example. Here's one. This is from ABC News. Approximately 40% of Americans use opioids to manage pain. So why isn't everybody addicted? Anyway, according to the federal government study, with deaths more than quadrupling between 1999 and 2015. That's a period of 16 years. Well, what they left out was, if you took the 16-year period before 1999, guess what? Deaths quadrupled. So this brings us to looking at some graphs that the government through the CDC has presented, and I'm going to show you on the graphs. I know graphs are a little boring, but this is what they are putting out to convince everybody to stop using opioids. That's their goal, is they believe opioids are possessed by the devil, cause addiction. As a matter of fact, this fellow, Dr. Andrew Kolodny, testified in court at Johnson & Johnson trial that 25% of the 10 million people who take opiates, pain medicines, are addicted. Now, we, in searching for the truth, found out that there's no reported addictions at all after a person starts on their treatment, say after the first month. So the key thing is the use of bad logic. And remember, we talked about the logical fallacy that when the rooster crows and the sun rises, the rooster causes the sun to rise. There's even a special name for it that I forget. But anyway, that is written in books on logic, and it is false logic, and it assumes because one thing comes before the other that the two are related. So here is a graph that shows that the prescriptions are coming down, that's the bars, and look at the overdose deaths in yellow. This was made by Dr. Richard Red Lawhern, and this is part of truth telling that we're going to start doing. Now, when we present this information, we have an email address, nationalpaincouncil@gmail.com. Anybody that wants to discuss this or refute it can email us and we can talk about it. But you see, the problem is that the claim by these two men that more prescriptions cause more overdose deaths is not true. So what we have is rooster logic. So this is the logic of the rooster. The sun rises in the morning, therefore, and the rooster crows in the morning, the sun rises, therefore the rooster makes the sunrise. People are taking more prescription drugs, therefore that causes more overdoses. Nope. That's bad logic. It's even worse logic because when they made that statement at the CDC, it had already had a decrease in prescriptions. So their logic shot their own foot off. But they are determined to work off this premise of overprescription, which we're going to be talking about quite a bit because we think that's the central problem. Now, this little graph is another attempt to obfuscate. In other words, to make things unclear. Now, there's lots and lots of PhDs, scientists at the CDC. This is, here's a little bigger one. This is a fundamental graphing error that makes the problem look worse. Their goal was to make the problem look so bad that you're afraid. And start to see if they can gaslight doctors into blaming them. That's what Dr. Frieden did when he said that the overdose epidemic was caused by doctors. Even the name of Dr. Kolodny's group, the Physicians for Responsible Opioid Prescribing, kind of sounds like everybody else is being not responsible. So anyway, this is a graph, and this are rates. This is, 6 people per 100,000. When you have a graph with rates, you have to use what's called a semi-log. And here is the proper with the black line. That's what it should look like. But this is what they made it look like to scare people. Fear is the big problem in all fear epidemics. Communist, HIV, witches, you name it. Now, see if I have the other graph here. The other assumption is more prescription drugs, more opiates cause more overdose deaths. That's the basic premise that the CDC and Dr. Frieden have put forward. But if you look at the deaths in each state, it turns out the states with the lowest number of prescriptions per person have the highest rates. And the states with the highest prescriptions have the lowest rates. It's just random. And so we've made the assumption that more pills cause more overdose deaths. The sun rises because of the rooster crowing. It's exactly the same logic. It's okay to have a premise and say, okay, my premise is that more opioid pills, more pain medicines, cause more overdose deaths. So what you do is you cut back on the prescriptions and see what happens to the overdose deaths. So there's been the DEA, the Federal Drug Police, have the power to cut back manufacturing. Doctors are not prescribing, pharmacists are not prescribing, veterinarians are not prescribing, dentists are not prescribing. Everybody's jumped on the bandwagon of more pills cause more addiction. And so there's been a reduction of more than 30% in the total number of pills prescribed. And so, according to the hypothesis, the death rate, overdose death rate, should be dropping. Guess what? It's gone up. So if you're using the same logic, you have to say that cutting back on pain medicines, on opioids, has caused the death rate to increase. You can't have it both ways. So we are going to continue this discussion of overdoses and overprescribing and the fallacies of the CDC guideline, and we're going to introduce a guideline that should be substituted. We are asking the CDC to completely rescind the guidelines because they're stuck now in the states, and they're going to stay stuck, and they're going to negatively impact the doctor-patient relationship from now on. Thank you and good night.